Avondale Children Thrive was formed in 2017 to combat infant mortality in the neighborhood. At that time, Avondale was ranked #2 in the nation for infant mortality. So we hired resident champions with lived experience to work with moms, expecting parents, and moms of young children to coach them, connect them to resources, and just be a supporter for them. We've been doing this work for 5 years now, and we've seen positive impacts in safe sleep, community level change, breastfeeding, and just community leadership in general.
Avondale has a rich history, but there's also opportunities to address some of the health equities. We know that no matter what dimension you look at, whether it's education or health or economics, there's going to be a difference in Avondale and maybe other communities that have higher income levels. So that's really been the basis for our partnership, is to address some of those health equity gaps so that we can ensure that the residents of Avondale have the same opportunities, especially the children and families in this community, to have higher quality of life, to have educational opportunities, and to achieve the same outcomes as every child in the city of Cincinnati and really in any community across the country.
As a resident health champion, I'm like the voice to the people. There's so much injustice going on. And in these times, we're trying to change the concept of redlining. It was a lot of things done to us, but one thing about TCB, they're doing it with us. And that's the most powerful part. The society has grown to a place where there are things that have done for us. But the key component is doing it with us, so we can all grow, so we can all share, so we can all establish into beautiful beings.
The community builders, the developer who led the Avondale transformation, came up with the strategy to fill the spaces that would be the commercial tenants here in the town center. It became clear that bringing in amenities that every healthy neighborhood should have, services that could be useful in the community, and really lifting up Black-owned businesses and locally owned businesses as really the forefront of the retail effort. There is a pharmacy that's coming. There is the grocery store, the space we're standing in now, that is probably the keystone of the whole project. There's a health center with UC Health and the Cincinnati Health Department. There's a laundromat, there's a daycare. All these businesses were not in Avondale or were not of this quality, and so we're really excited about that part of the project.
It's so important for City Council to support these efforts in Avondale, that it sets a standard and it prioritizes the health of the community members here in Avondale. So having that support from the top just sets a tone for what's happening in the community overall.
You know, we really want to lift the health of children to the highest level that we can, because they really are our future. And we want to ensure that we're given the greatest opportunities for education, social change, economic development for children, for parents, for seniors, but more importantly, there's great organizations in this community who share our vision of ensuring that we're improving the health of children.
So we've solved a lot of the community safety and pediatric health crises issues that we came in with, and we have great progress in those marks. And now we can turn to sort of upstream benefits of healthy housing, of community assets like the town center, healthy food access, banking, and all the great ways in which residents can lift themselves up.
The Getting Further Faster initiative has allowed our 3 major organizations to really come together and continue the work. It's very easy to get caught up in our individual agendas and organizations, but this initiative has allowed us to push forward and think about what's next for Avondale Children Thrive.
We've understood what it meant to be neighbors here. And being a neighbor means that we all need to work together to ensure that there's quality of life for everybody. But more importantly, there's great organizations in this community who share our vision of ensuring that we're improving the health of children.